guys, welcome back to my YouTube channel. If you're not already subscribed, make sure you hit that subscribe button. If you are, make sure you like, share, and comment on this video. I've been getting a ton of comments asking about a bachelor's in public health, which makes so much sense because I talk a lot about a master's in public health. So this video is specially dedicated to people who are pursuing their BPH. Make sure you stick around and watch the entire video. So the number one question I get from people who have their bachelor's in public health is, what can I do with it? What entry-level jobs are there? How do I use this degree? There are a lot of administrative jobs, whether it's working in a hospital or a community center. Those are great opportunities for people with a bachelor's in public health. People who have their masters are able to lead in the work, and then people who have their bachelors are able to assist the leaders in doing public health work. I'm going to list a few positions and salaries that people with a bachelor's in public health can definitely pursue. So the first job up is a health and safety engineer. Some of you may be wondering, what the heck is that? A health and safety engineer is essentially someone who prevents people from getting sick. People who are health and safety engineers make up to $89,000 a year. Now, if you're about to graduate college or all you have is your bachelor's in public health and you have no experience, I wouldn't expect exactly to start out and make that $89,000. That's probably people on the higher end, but in the median, $89,000, likely you can make as low as $65,000, which still isn't that bad. The second job is an environmental scientist or an environmental health associate, environmental health specialist. People who are in environmental health obviously work on improving environmental health. So for example, people who live in underserved communities that have bad water, someone who is an environmental scientist might test the water from the different homes in the community, and the associate may assist the scientist if you're not that exactly. You can make up to $80,000. The third position is emergency management. Again, you might be wondering, what is that? So if you think about this pandemic, it's not just the big leaders and the directors who make those decisions and help building those emergency preparedness briefing packages, one that we're not using all that wisely right now. But there are definitely people on the ground as an associates and specialists who also help with building those type of documents. The fourth position is a community worker or a social services associate. A lot of people think you have to have your social worker's degree to do anything in social work, but that's definitely not true. There are people who have their bachelor's in public health who work in social services. So community workers make about $60,000 a year. A lot of people don't like community work because you get paid less, whereas working for a big pharma, you might make a lot more money. But one thing I want to note is Obama, our forever president, was actually a community worker. So if that's something you're interested in going in, following in his footsteps, for example, let's say that you have your bachelor's in public health and you're interested in getting involved in politics, more on the health side, it would be good to start as a community worker so you can understand what your target demographic needs and really understand the people who are in that community, so that when you get up to that governmental policy level, you're able to remember this is what the community needs, similar to Obama's. The fifth is an assistant. So you might be thinking, I did not go to college to be an assistant, but you would be an assistant to an epidemiologist, an assistant to a biostatistician. Now, to be an epidemiologist, you have to have your master's or your PhD, and then to be a biostatistician, I believe you also have to have your master's in public health concentrated in biostatistics. Of course, there are some outliers out there who don't have their master's, so you could try, but most places require you to have that master's unless you have, what, like 10 years of experience. Being an assistant to an epidemiologist or to a biostatistician kind of broadens your perspective on what other options are there. So let's say if you were an assistant to a biostatistician, that biostatistician may be working on clinical trials, whereas you'll be able to get that experience by way of assisting that biostatistician. So if you're interested in breaking into pharma or clinical trials kind of research, I would think about being an assistant to an epidemiologist or a biostatistician. For an assistant position, you can make anywhere from $60,000 to $70,000. That's just the average, again, depending on where you live, what you're doing, what your responsibilities are. The last position that I want to tell you guys about is what I always talk about, and that is regulatory affairs. This is the sixth position that you actually can apply to if you have your bachelor's in public health. A lot of people think you have to have your pre-med degree, biology, biochem, chemistry, science, basically a life science degree in order to move into regulatory affairs, but a lot more companies are open to the idea of people who have their bachelor's in public health applying to jobs in pharma. So essentially, I believe the reason for that is people who do have their bachelor's in public health have an understanding of public health, and that's the whole point of pharmaceuticals, is to address a health concern within the public. If you're interested in regulatory affairs or pharma, dietary supplements, and even medical device, you can definitely apply to regulatory affairs jobs, and regulatory affairs jobs make great money. I would say starting out, you might start at $60,000, but you can go upwards from there. And there are other videos that I've made talking about regulatory affairs and how much money you can make by pursuing a career in that. Well, those are the main positions that I have for you guys. The general advice I would give to people who have their bachelor's in public health is you are really one step ahead of the curve. A lot of people don't know they want to work with public health needs until they're already 5, 6, 7, 8 years out of college. But if you're already on track and understanding that this is what you want to do, now the biggest challenge you have is just exploring all the different opportunities there are in public health. And like I said, whether that's serving the community as a community worker or working in big pharma, or maybe working in a hospital, working for an epidemiologist, working for a biostatistician, whatever the case may be, you're definitely one step ahead of the curve. If you need a little bit more assistance or guidance on how to apply your bachelor's in public health, or what jobs you can apply for, or even where to start, make sure you visit careersavage.com to schedule your consultation. Thanks for watching, guys.